The U.S. Food and Drug Administration is stepping up efforts to ensure the reliability of certain diagnostic tests. This is especially important to thousands undergoing genetic testing every year. There's also movement towards increased testing to help fight the genetic diseases impacting Americans. Joining us to learn more about those initiatives are Dr. Jessica Spencer and Caroline Gold, whose daughter suffers from a rare genetic disease. Good morning to you both.
Good morning.
Thank you. Good morning.
Thank you for having us.
So what exactly is genetic testing, and what information can it provide, Dr. Spencer?
Genetic testing is a medical test that can be done a variety of ways to give somebody information about something they may be at risk for. So in the case of J-Screen, which is what I'm here to talk to you about today, this is a kit that screens somebody for 80 different genetic diseases to see if they're carriers for this disease, which wouldn't happen to you personally, but if you test positive and your partner also tests positive, you would be at risk of having a child that is affected with one of these diseases. So this is called a carrier screening test. And this gives people information and provides choices for them before they have children.
Is this type of a new medical breakthrough, or is this something that you've been doing for a long time now, providing to us?
Yeah, I mean, you know, carrier screening has been around for a long time, but it's underutilized. Unfortunately, most children who are born with genetic diseases come into families that have no prior history of this. So there's a common misconception that if you have no family history of anything, then you don't need carrier screening. But carrier screening is more about identifying couples who are at risk who wouldn't know otherwise, because most of the time these couples, they just say until they have an affected child, they didn't know that they were at risk for this.
So Caroline, tell us about your experience with genetic testing.
Before my husband and I got married, we knew that we should be tested for diseases that are common in the Jewish population. So we went to our doctors to ask to be screened, and they both screened us for what they thought was a complete panel of diseases. Our daughter Eden suffers from a disease that we're both carriers of. She has something called mucolipidosis type 4, or ML4 for short. It took us 18 months before we could get a diagnosis for Eden. She went to many doctors and had many tests. When she was 15 months old, she went to a neurologist who, after reading her MRI, called us that night to tell us he didn't know what was wrong with Eden, but we should be prepared for a lifetime of pain. He then referred us to a geneticist who diagnosed Eden with ML4, which should have been a disease that was on a panel that one of our doctors should have tested us for. So after hearing that news, my husband and I worked to create jscreen.org, which encourages families to be tested before having children for a complete panel of diseases to avoid being in the same situation that we are today.
So are you saying that with the genetic testing that some of these things can actually be, prohibited? I mean, something like this can really change the plan that you have for your life. So would you say that parents and couples out there should do the testing and maybe have that chance to prevent something like that from happening? What would you say the ultimate message is?
I think that anyone planning on having children or knows someone having children should log on to jscreen.org. We're all carriers of certain diseases, especially all of us of different ethnic backgrounds. And if you're once logging into jscreen.org, and if you order a kit, which is now a spit test that you can do in the privacy of your home, you send this back to JScreen, and then a genetic counselor will work with you to talk about your results. So at least you have the information of how you can go forward with having healthy children. But it's all about knowing and having this conversation before having children.
Now, Dr. Spencer, what would you say to your patients out there? I mean, what would be the first step that you would want them to take as far as the genetic testing goes?
You know, I bring it up at their first visit. I'm an infertility specialist, and so these couples are struggling to conceive, and before they actually get pregnant, I want them to consider genetic screening. I think it's really important. Obviously I'm there to help them conceive in the first place, but there are things that we can do to lower their risk of having a baby with one of these genetic diseases. One example is in vitro fertilization with pre-implantation genetic diagnosis. This is a way a woman can conceive and have a healthy child, an unaffected child, even when she and her partner are both carriers, and that's what Caroline did. There are other options, certainly. I mean, people can elect to use donor sperm, use donor egg. They can elect to adopt. They can choose just to try naturally and then just make sure they understand they're at risk of this and inform their pediatrician. So, you know, this is really about getting the information to people, and then once they have that information, properly counseling them with a genetic counselor about what that risk is and what their options are, and that just gives people, that helps them make better choices. So that's what genetic screening is about.
Well, and I think that the good news is that there are options out there. You know, I think so many times people are just afraid to get certain testing done because they're scared of what the results might be, but not necessarily with this case. So the good news is that there are other options.
Many options.
Yeah. Where can we get more information? Do you have a website that we can go to?
People can go to jscreen.org, JSCREEN.org, and from there they can order a home saliva kit. And they can also get additional information about the screening.
Dr. Spencer and Caroline, thank you both so much for joining us today.
Thank you so much.
We're going to have more on this segment posted to our website. Just go to fox4morningblend.com.
Now get ready to focus. Up next, we are talking eye health and how it is often overlooked, how your vision is a crucial part of your overall health.